Let's see about the mechanism of labor. That is, what are the steps in the process of labor, delivery of the baby. For that, we should first know the definition of mechanism of labor. It is a process by which the fetus maneuvers itself to the pelvic architecture so that a safe vaginal delivery of a live fetus occurs with minimal morbidity and mortality. Both to the mother and to the baby. So the mechanism of labor is nothing but it is a process by which the fetus maneuvers itself through the pelvic architecture so that a safe vaginal delivery is possible. The outcome should be a live fetus and there should be a minimal morbidity and mortality to both the mother and the child. So this is the definition of the mechanism of labor. Now coming to the cardinal movements of labor. The cardinal movements in the order include engagement of the presenting part, then there is descent, followed by flexion, followed by internal rotation, then there is extension, restitution. After restitution there is external rotation, finally expulsion. These are the cardinal movements of labor and we will see in detail about each one of these movements. So all these movements occur simultaneously during the process of labor. Before seeing each one of these steps, we should know something called as vertex. In the normal labor, the presenting part is the head. So there is something called as vertex which acts as the presenting part. The vertex is nothing but a diamond shaped area or a rhomboid shaped area in a fetal skull which is bounded anteriorly by the anterior fontanelle, posteriorly by the posterior fontanelle and laterally by the parietal eminence on either side. Anteriorly that is anterior fontanelle, posteriorly the posterior fontanelle, laterally by the parietal eminence. This is the vertex. So in a normal labor during the onset, the vertex presentation is the most common type in about 95%. And the most common position is the left occipital transverse position. That is, in the skull, the occiput lies towards the left side in the transverse plane. So there is left occipital transverse position which is the most common. by which the fetal skull enters the pelvis. Now let's see the cardinal movements one by one. First will be engagement. The definition of engagement is the greatest diameter of the fetal head has passed through the pelvic brim. As we have seen in the pelvis video, the greatest diameter in case of the inlet in the pelvic inlet is the transverse diameter, which is around 13 centimeters, and the greatest diameter of head engages along the sagittal suture. So this means that the sagittal suture of the fetal head gets engaged in the transverse diameter of the pelvic brim, that is the greatest diameter. So this is the process of engagement. So this is a picture showing the engagement, in which the rhomboid or the diamond shaped area of the fetal head is the vertex. So the one in front is the anterior fontanelle, and this image shows the engagement of the head. So along the transverse diameter of the inlet, which is the greatest diameter. So sometimes what happens is there will be slight deflection during the engagement, either anteriorly or posteriorly. So that is called as asynclitic engagement. Which is of two types, anterior and the posterior asynclitism. So in anterior asynclitism, as seen in this picture, the sagittal suture is near the sacral promontory, and thereby this results in anterior parietal presentation. The parietal bones face anteriorly, so this is anterior parietal presentation. This is called as anterior asynclitism, and this is also called as Naegele's obliquity. Whereas in posterior asynclitism, the sagittal suture lies near the pubic symphysis. So here there is posterior parietal presentation, and therefore it is called as posterior asynclitism. And this posterior asynclitism is also called as Littmann's obliquity. Littmann's obliquity. So this is about the engagement. So the second is descent. There is descent of the fetal head from the pelvic brim into the pelvic cavity. So here, what are the factors which help in the descent? The factors responsible for the descent include the intrauterine fluid pressure, the uterine contractions, and the bearing down efforts by the mother also the extension and straightening of the fetus. So this is the descent. The next cardinal movement is flexion. So flexion usually is associated with the descent. So as the fetal head is descending, there also occurs flexion. There is maximum flexion to an extent that the fetal chin touches the thorax. So this is flexion, and therefore the engaging diameter is changed from the occipitofrontal diameter to the suboccipitobregmatic diameter as the engaging diameter. So initially it was occipitofrontal diameter. Now because of the increased flexion and the complete flexion, there is suboccipitobregmatic diameter which is engaged. So the fourth would be internal rotation. So in the internal rotation, the occiput moves towards the pubic symphysis. The occiput moves towards the pubic symphysis. Normally, as the head is in left occipito-transverse position or left occipito-anterior, the head rotates 1/8 of the circumference to get into the anterior position, that is, it comes under the pubic symphysis. This is the internal rotation, and the internal rotation occurs at the level of ischial spines. So when the head reaches the level of ischial spines, there is the presence of levator ani muscle which acts as a gutter, and thereby with each contraction of the levator ani muscle, because of the pressure exerted by the descending fetal head, so along the contraction of the muscle there is simultaneous rotation of the head, thereby there occurs the internal rotation. So finally the occiput comes to lie under the pubic symphysis. So as you have seen already, the rotation is about 1/8 as in case of the normal left occipito-transverse or occipito-anterior position, which is nothing but around 45 degrees. The next step is the extension and the birth of the fetal head. So after the internal rotation is completed, now the occiput is under the pubic symphysis. And the head is flexed. So now with further uterine contractions, there will be birth of the fetal head by the process of extension. The fetal head is always born with extension. So the extension is the result of two factors. One is because of the uterine contractions which act from above, and then there is also the elastic resistance of the pelvic floor from below. These are the two factors which lead to extension of the head of the fetus and thereby the birth of the head. So as a result of extension, the occiput hitches against the symphysis pubis and the face sweeps over the perineum, and thereby the successive parts of the fetal head are born. So this is the birth of the head of the fetus. Next will be restitution. So here what happens is, as soon as the head is born, it rotates 45 degrees to just untwist the neck. During internal rotation, as we have seen, the head rotates by 45 degrees inwards. So in restitution, this is like a compensatory mechanism. So it rotates opposite by 45 degrees so that there is untwisting of the neck, and the chin rotates towards the right in case of left occipital anterior position and towards the left in case of right occipital anterior position. So there is untwisting of the neck by rotating 45 degrees, and the face and the chin rotates towards the right in case of left occipital anterior position and towards the left in case of right occipital anterior positions. This is restitution. Next will be external rotation. So after the untwisting of the neck, next will be the internal rotation of the shoulders, and thereby the bisacromial diameter becomes the engaging diameter, and then there is delivery of the shoulders, in which the posterior shoulder is delivered first, followed by the anterior shoulder, which is under the pubic symphysis. Along with that, there is external rotation of the head. There is external rotation and expulsion. Just as said, there is external rotation and followed by the expulsion initially of the shoulders. That too, first there is delivery of the posterior shoulder and then the anterior shoulder, after which there is delivery of the whole body. So these are all the cardinal movements of the fetus and the mechanism of labor. Now let's revise everything with the help of diagrams. So the first step is engagement. In which the largest diameter of the fetal skull enters the pelvic brim along the transverse diameter, that is the engagement. The most common position is the left occipito-transverse position or the left occipito-anterior position. In this image we can see the left occipito-anterior position. This is the left side and the right side. So the occiput is towards the left and little anterior. So this is left occipito-anterior position. This is the engagement. Next will be the descent, then the flexion. So there is descent of the fetal head and there is increasing flexion to an extent that the chin touches the thorax of the baby. Until then there is flexion. The next step would be internal rotation. So in internal rotation what happens is, this occurs at the level of ischial spine, where there is levator ani muscle which acts as a gutter, and with contraction relaxation of the muscle there is internal rotation of the fetal head from the left occipito-anterior transverse to the anterior, so that the occiput comes and lies under the pubic symphysis. This is internal rotation which occurs at the level of the ischial spines. Next will be extension. So once the head is internally rotated, there is delivery of the head by the process of extension. This occurs when the occiput hitches against the pubic symphysis and then the face sweeps over the perineum and the successive parts of the fetal head are born. So after extension there is restitution, which is nothing but the untwisting of the neck. So initially it was in left occipito-anterior position, from there it has went to the anterior position. So in restitution it again untwists itself by rotating 45 degrees to its original position. So this is restitution, so that the chin and the face of the baby faces the mother's thigh. Next will be external rotation. So there is external rotation of the head as well as the body, and then there is expulsion. So the expulsion is, first there is delivery of the posterior shoulder, as the anterior shoulder hitches against the pubic symphysis. The posterior shoulder sweeps along the perineum, and after which the anterior shoulder follows, and after the delivery of the shoulder the entire body is delivered out on its own. So this is about the mechanism of the labor, the cardinal movements seen in the labor. Thank you.